Right. Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their niche and what they do. Today, we have a special guest, Dr. Lacey Mays. The title today is going to be Chiropractic, Motherhood, and Intentional Healing. So you can also find her right now at Brood Balance Wellness on Facebook. Her website is under construction, and we're going to be learning about how she's helping all of these beautiful women that have babies and also men. So it's not just, you're not exclusive, men. You do need to get aligned. So you're not getting out of it that easy. So thank you so much, doctor, for being here. I appreciate it.
Yes, thanks for having me.
Yeah, tell us about a little bit about yourself, how you got into chiropractic, and what you're doing currently right now. That'd be cool.
So I got into chiropractic because I actually had migraines. My neurologist referred me to a chiropractor, and it just kind of stuck with me. I loved all the holistic approach to everything. I felt better, like my migraines went away for a while, so it was really great. Then I decided, okay, I'm gonna get my MBA so I know how to run a business, and I'm gonna go to chiropractic school and eventually have my own practice. So here I am having my own practice. I see everybody, families typically, but moms and babies are really what I see the most of, I would say. So my big passion with that is, yes, I want to support, that nervous system through chiropractic care. That's what I went to school for. But it goes deeper than that for me. I love functional medicine. So I do a lot of lab testing. I do a lot of Dutch hormone testing. I use Genova for their metabolomics testing. So all that nutrient testing. So I really have a passion for helping women. I believe that, they deserve to be heard. Too often where you go to the doctor and it's, your labs are normal, everything's fine,
Yeah, exactly.
right? But no, they feel exhausted, they're anxious, they're, inflamed, they're burned out, they're struggling with whatever it is, fertility or sleep issues. They just feel that disconnect from themselves.
Yeah.
So my role really is to help support them, right? Getting to that root cause, that functional approach, but also supporting that nervous system.
What does functional medicine mean when people we hear that word thrown around? What is that?
I feel, everyone's going to have their thoughts on what it means. I feel like it really means we're looking past this piece of paper with these numbers on it and these ranges. Just because you fall
Love it.
into a range, right? That normal range doesn't mean optimal. So we want to be optimal, but with that being said, what are we missing? Like most of the time, especially women, we're functioning on our stress hormones. We're functioning on that cortisol and the coffee and,
Yeah.
all the things just to keep us going. But really, that functional medicine piece is breaking that down. Like, what are we missing here? Why is our cortisol the way it is? Why do we feel like we need coffee to get through the day? Like, that's
No
like
pun
drinking
intended.
coffee.
See, I wonder with you too. I wonder why.
I love it. But really, that's what it is. Like, I want to get down to the bottom of it. Like, we need proper nutrition. We need that to make things work in the body. And if we don't have that, we're not optimal functioning. Our body is not going to feel safe for, reproduction.
Right.
So
Wow.
that's really that functional piece is just getting to the bottom of it. What are we missing? What do we need to look into further? Where do we need to, you know, supplement if need be or change our diet, get that actual nutrition in there.
I love that. I love what you do. What you're saying is I'm not gonna when I'm helping people, I'm not gonna go with the status quo. It's funny, like a gentleman like myself, I go to the doctor and I see my testosterone levels are 400. You're getting old. It's you know what? That's normal. No, it's not normal because my
Mhm.
my sh- my my level should be at least 1100 or at least, I mean, really high. So it's what I love about functional medicine is we're not going to go with above average. We're going to go with where you need to be, whether you're 20 or 15 or 30 or 80, because we should be at optimal level and we can keep our levels high, whatever it may be. What I love what you do is you you literally go old school. You're going old school, and what I mean by that is you're going to their house, and I love this because 'cause you're helping a lot of women that maybe are having babies. or maybe they work at home. That's kind of like the new thing since COVID. You know, how does that work? They send you a text, or how do they normally find you, and what's the protocol? I'd love to hear about that.
So when I left my practice, that I was an associate at, I did have people that wanted to follow me. So after I left, they reached out to me. So I kind of had that going for me. But as far as like new patients, it's very much word of mouth. I get referrals from like midwives, doulas. There's a local pediatrician that refers to me.
Wow.
So yeah, mostly word of mouth, honestly, is
So
how it
so
goes.
you're zooming.
Yeah. And let me tell you, moms talk like that. That is the biggest thing that can either make or break you.
Really?
Uh, absolutely. There's a huge community. If moms want to know something, they just got to ask another mom. And where do I go?
Wow.
Who do I see? And they're going to tell you, hey, don't go to this person or go to this person, you know? And so that's
Wow.
really been how I've gotten the majority of my business.
That is awesome. I like it though. It kind of reminds me back in the 50s. I wasn't there, but from, watching movies, how
Mhm.
they would go to your home. It was personal care. In a way, you're doing
Yeah,
personal care, and it's in the
absolutely.
comfort of their own home. They're comfortable, and they're busy moms, or, we'll say even busy fathers. Even sometimes fathers work at home. So, I mean, people don't realize that.
Absolutely.
And what kind of gave you this idea to do the whole mobile chiropractic? What yeah.
I really like I looked at a couple places for brick and mortar, but nothing was just pulling at my heartstrings as much as, I want to be able to go to them. Like so many times I feel like, we had cancellations and it was because of, not being able to come in for XYZ reason,
Smart.
whatever, right? But hey, it's fine. Like I'll come to you. Well, I'm sick. That's fine. This is a perfect time for you to be adjusted.
Wow, I love it. So, and how long have you been doing the mobile chiropractic?
Just since April.
Okay.
Yeah,
Okay,
beginning of April.
awesome. That's awesome. And so I would say that the thing that I would like to kind of talk about is, you know, the topic here is motherhood and intentional healing. What does that mean to you? And yeah, start there.
Yeah, I mean, I'm a mom, I have 2 boys. I had my fair share of struggles with fertility and miscarriages, and my heart really goes out to other moms and other women that are, going down that path. So, really that intentional healing because I went through some things, right, in my own journey, and then also being a practitioner, I've learned some things, but I just want to help women. I want them to feel heard, I don't want them to feel alone, and I know most of the time they feel like they go to the doctor and they get blown off, but the most important thing is to me is, like, people just wanna be heard. Like, sit down, let's listen to what's truly going on. What is your life like? What's happening in your day-to-day life? How stressful is it? How are you managing that stress? Because not all stress is bad, but how are we managing it, right? That's super important. And then what are we putting into our bodies? What's going in to help support that? And nowadays, that's tough. Everybody, lives on coffee and ultra processed food. We're so
100%.
fast paced. Like,
You're right. We want it now. And then when we
yeah,
get it now, we hurt later.
yes. But a lot of people aren't
Wow.
connecting those dots.
Wow. Wow. Okay. So you do a lot here. You do a lot. You're not just a chiropractor. You're a bartender. I'm playing, because I had to throw in there, no, I mean, what I mean by that is, no, this is beautiful because you're hitting on things that a lot of doctors and chiropractors don't hit on. The patient or the patient comes in, they crack, adjust, you're on your little way. You're going a little bit deeper because and you're also looking for the root because see there's a root that causes pain or inflammation. And so and by then talking, you're able to kind of see where they're at, where their stress is in their body, where it's being focused on, lower body, whatever, upper. And they're also telling you kind of what they're going through at the same time. So in a way, they're being released. They're getting a couple releases, not just the adjustment, but also getting it out because some people
Absolutely.
just don't feel like they're being heard. And because if you have correct me if I'm wrong, but if you're talking with somebody and you hear a lot of negativity over and over, you already know what to work on.
Yeah,
how to
for
talk to them and how to guide them,
yeah.
and so you become a treasure. No,
I
I'm being serious. You become a treasure because, men are very different. We bottle it up and we don't really share unless we do a one-on-one with the guy and we're like, "Hey man, I'm really struggling here," and it takes sometimes a lot for a guy to even, and then when he releases it, he's like, "My God, I feel like I just got an adjustment."
Mhm, mhm.
So in a way, you're doing a double adjustment. Where did is that something you learned, or was that just something that just kind of came out of you?
Uh, it's something that I've always been passionate about, and I have actually started taking courses through DAPC to get my diploma as chiropractic internist. So I take some courses there. I do a lot of like webinars and different trainings on like women's health, nutrition, hormones, all sorts of stuff. I mean, I got
Wow.
to stay learning and going, and that's part of being a practitioner, but also like that's where my passion is.
Mhm.
So
Wow.
that's kind of where I gained
So
that.
how
And
do you
then my last practice as well. So
Okay, okay, so double dip in here. So on the hormones, do you help women with their hormones also, or can we talk a little bit about
Mhm.
that? And do you see that there's a decline, or more women are really out of balance and they don't even know it?
I will say maybe a little bit of both, right? Women are doing all sorts of things, kind of all over the place. But also just like the way everything is in society today, like all the endocrine disruptors, the nutrition, all the things we're exposed to, right? I see more and more women that are younger that are struggling with symptoms that are commonly associated with hormone shifts and
Mhm.
nervous system dysregulation, right? So we have to have that nervous system piece. We have to have that adjustment that is what helps support, our innate ability to heal ourselves. But, women, they often get told they're too young, right? You're too young to have this. But I don't think that's the case anymore. I think that is the new shift that we're going into.
Wow. So, with the women that are watching this right now, how will they know if they're even out of balance? Like, what are some of the symptoms and the signs?
You're going to notice a lot of like sleep stress correlations, just that fatigue, the brain fog, even like anxiety type symptoms, some hair loss, brittle nails, a poor temperature regulation. You can even have like dizziness, restless legs. There's a lot of like overlap.
Okay.
So that's most of the time, especially if you have any type of anxiety, symptoms, you go and that's what you talk about. And well, here, try this, right? Not actually like what is the driver here?
Right, right, exactly. So, when you know what the driver is, so maybe give us an example. So, let's say, we'll call her Michelle. Michelle calls you up. She has a
Mhm.
3-year-old, and you're coming to her. And when you sit down with her, I know you don't just go right away into adjusting. How does that work? What's your protocol?
Like I want to hear their story, right? 90% of your diagnosis is going to come from the history anyways,
Right.
right? So I want to know your story. What have you been through significantly, especially trauma, because our body hangs on to trauma. Our fascia holds on to that,
Yep.
right? So if we have trauma, we're just kind of fighting that uphill battle until we can release that. But that's one of the things I really like to just sit down with women like, yes, I'm here to adjust you or to, talk about your functional nutrition, whatever it is. But more importantly, I'm here for you. Like what do you need? Where are you at in your life? Are you struggling with, irregular cycles, with mood shifts? Are you struggling with not being able to sleep? Like what is that driving factor? And with kids, like, it's harder, right? Especially if they're younger. Of course, they're struggling with sleep. But
I wanna play my video games.
but also, right, like, there's more to it than that. Like, are we struggling with this fatigue that's keeping us from playing with our kids? Are we struggling with this brain fog where we can't remember anything and we have to look everything up, or we need to take, a nap all the time because we can't function, or we need to drink, a million
Massive amounts of
coffees
coffee.
right, like, what is it here? And, honestly, being able to do some of that, further testing to really see, like, on paper, "Hey, this is where you're falling. This is where we need support. Like, let's support you so that your body can take over and move on,
Mhm.
do what it's supposed to do."
Okay. I like that. So after, I'm just kind of going to go with the flow. So let's say after we kind of find out what's going on, do you normally recommend like, I know everyone's different, but do you normally
Mhm.
recommend like maybe once a week, twice a week, once a month? Do you have kind of like a flow chart or?
For adjustment wise, that
Yes.
definitely depends, right? Everybody's gonna be different on what they need, depending on what their diagnosis is,
Right.
what they're going through. Personally, just for that, like, maintenance, keeping that nervous system going,
Right.
I love the once a week adjustments. I think that's fantastic, but there are some people, especially, like, financially, they're like, "I just can't do that." I'm like, "Once a month, at least."
Right. At least.
At
Right.
least, right? But at the same time, like, everything has a cost. What are you willing to pay, right? Everyone says, you give them a cost, "Hey, this is gonna be so much money."
Mhm.
Well, that's too much. Okay. Is it too much, or is it just we don't prioritize what this means, what this truly can give you?
I like that. And so what you're basically saying without saying it from what I'm reading between the lines is that you're worth it. We
Yes,
need to stop
absolutely.
looking at our body like we have a second chance. We don't have a second chance.
Right. Ab
So it's self-care. How
Right.
much are we willing? It's funny. We'll go out to dinner and go spend $300.
Absolutely
Think
correct.
nothing of it. And
Yep.
we have nothing to show for it.
Right. That's
I
why
agree with you.
hour of good time, right? And
Was it worth it? No, it wasn't worth it. I agree with you 100%. It's funny. I was talking to a doctor recently and he said, I look at our bodies like a vehicle. Are we going to, if I were to just put gas in it once a month, is it going to run well? No,
right.
you got to put gas in it once a week. If, I mean, at least I know I do. And that's a whole different story, another podcast. But you
Right.
know, are you going to put in lead or are you going to put the best? You deserve the best.
Right.
And I think that a lot of people self sabotage themselves, and they don't
Oh,
realize, no, you're worth it. And without the function, without your health, you don't have your wealth. People have it backwards. They think that, oh, I need to go grab the wealth. And then when they get the wealth, then they have a problem with their health, and it's too late.
mhm.
You know, uh, how do you explain that to people when they say, "Well, no, I think maybe every other month is fine." Like, how would you talk to somebody like that? I'm just curious.
Honestly, I just break it down. I'm pretty real with my patients. Like, I'm not gonna beat around the bush. I'm gonna tell you if I think that you need something or don't need something. I'm not here to just sell you on something, for me to make a paycheck. What I'm here is to help you. Like,
I love
that's
it.
more important. That's what I want. Um, and I think that goes a long way too when people can truly see, the meaning behind why I'm telling them these things. I explain the importance of what it does, what an adjustment truly does to your body. What could this additional testing give us? What could these supplements give us? And like with supplements, like I often tell people like, "Hey, I don't want this to be a forever thing. I don't want you on supplements forever. I want you to, have some support here. Let's get you to a better spot and let's make these lifestyle changes so that we can get what we need to get, from our nutrients, from our chiropractic adjustments."
Well, you know, I really like how not only that you're mobile, but I really like how you get into. I don't want to use the word psyche of it, but really into the mindset of what's really going on. You're looking for the root, and I
Yeah.
think that that's something that has kind of been a lost art. I think talking has been a lost art. This right here,
Mhm.
communication, we're becoming so
Oh,
mobilized to the point where we don't
yes.
even know what is true or real anymore. And we think
Mhm.
that we're hanging out, we're friends when we see a post on Facebook. Oh yeah, like it's sad. And we're
Mhm.
losing that. People are I almost kind of I miss the 90s, man. I'm old school here, where I can just go up to a gal in the coffee shop and start talking to her. Now, if I were to try to do that, they mace me.
Mhm.
It's because they're not a lot of these people aren't in a real world. They're in another world. And I think that by you going out there and I call it healing hands because you have good energy. We're all energy. People get all spooked out when they hear the word energy. It's like, dude, we're all energy. And if you've got good energy and there's bad energy, you can overcome that bad energy if that person's willing to say, Yes, let me release it. Let me explain.
Mm.
How Tell me, maybe share a couple testimonials of maybe people that they weren't doing too well, and like after the session, they were like, "Wow, I really needed this, and this really helped."
I feel like most of the time I'll do a session and then I'll leave, and sometimes it's a couple hours later where I get a text, "Hey, that was great. Like, thank you so much. I feel so much better." That happens a lot with the babies too. I get some messages like, "She always does better, after your adjustment, like the gases decrease, they're more calmer, they're less tense."
Wow. Let's talk about that a little bit about, you know, why would babies be tense? I mean, they're just babies. They're fresh. They're brand new. I mean, they haven't seen Facebook. I'm just joking. I mean, they haven't seen TikTok, Instagram yet. How does that? I mean, maybe you can expound a little bit on that.
Absolutely. So most people are like, "Why would I take my baby to a chiropractor?" Because what they envision is the videos you see on TikTok,
Yeah.
right? All the cracking and let's hear the pops. I'm here for the pops. It's not like that with babies. Their nervous system comes from mom. So whatever mom's going through during that 9 months or even before, right?
Hmm.
That's where that baby's nervous system is coming from.
Right.
So if mom's stressed, mom's tense, well, baby's going to be the same way. And then add on top of that, which this probably gets a little controversial, but is oral ties. So like tongue ties, lip ties, that's all fascia connected head to toe. And if this is tight, sometimes I do have to say, "Hey, I'm concerned. I think baby needs to be seen by a pediatric dentist. They might need that frenulum released."
Wow.
But I got to refer, right? Because that's not my scope.
Okay. Well, so if a mother is tense and she carries a baby for all these months and the baby comes out, 90% of the time, 50% of the time, the baby's going to be tense, possibly when it
Oh,
comes out.
I would say easily 90%.
Right.
Yeah.
Okay. So the veins that they both need to be treated, and how would you how do you so I don't know, it just trips me out. Like how do you like adjust a baby? I mean,
It's not what you think. It's not what you think. It's like the pressure that you would use to test a tomato or a grape at the grocery store. Like it's very gentle. There's no like twisting, no loud pops. There's a lot of passive range of motion, like just getting that baby moving, working on the muscles from that standpoint, but also that adjustment is just very gentle.
wow. And so I just can't get over the chiropractic for babies. I've seen the videos, it kind of like, okay. But when a baby starts to get chiropractic care, would you say maybe once a month for a baby?
If they're really struggling with like latch, lots of tension, feeding difficulties, any kind of that general like discomfort, no, once a week easily. And especially if I'm concerned about potential oral ties, then I want to see them a little bit more and then refer to pediatric dentists.
Can you expand a little bit on oral ties?
Yes. So I deal with a lot of kiddos, mostly adults probably have them, but majority I see is kiddos because that's what I work with the most with that. Basically, what tends to happen is mom has baby, things go well for first week or so, and then man, we're really struggling. Baby's not wanting to latch or only wants to latch on one side. The latch is painful. They get like mouth blisters on their lips. Mom can get like super cracked and bleeding nipples. Like it's just so uncomfortable, right? And that's not what they envision. They're like, "Oh, you're gonna breastfeed your baby. It's gonna be great. You're the mom. Moms
Right.
can do this. They do it all the time."
Yeah.
Yeah. Well, now we have a baby that's struggling, right? So then potential struggling to gain weight. Well, now we can't get a good latch. So now guess what? We're taking air in because we don't have
Mm,
a good latch. So now we're going to have an increase in spit up, an increase in gas.
wow.
And baby's going to be uncomfortable, right? Because they're having all these problems. So that's why I check every baby for ties. And not all of them do I refer. Sometimes I refer to a myofunctional therapist in town so
Mhm.
that they can do some more like intraoral work and really work on that piece of things. but really just that tension, like, it's becoming more and more of an issue.
Wow. It's interesting. I never thought of that. Wow. I'm sure that. So let's talk about that. How do you help them with that? I mean, if they're already, let's say they're cracked or they start to bleed. I mean, I mean, how do you help out with that? I'm just curious now.
So, from a chiropractic perspective, obviously adjustments, right, to help
Mhm.
decrease that tension and support that nervous system regulation for the baby. But also, further with that is like looking at like that jaw tension, like
Mhm.
how tight are babies here with
Wow.
like PMJ? How tight is their, neck? Are they having a preference turning one way or another? Are they arching a lot? Do they have any like asymmetry within their body or like rib cage tension? That's kind of all the stuff that I look at and kind of work
Mhm.
on from that perspective.
Okay, that makes a lot of sense. Wow. So since you've been doing like mobile chiropractic and you're on your own, I'm sure you've learned a lot of stuff where you're like, wow, I didn't see this one coming. Like, have you like bumped into any of those, on the road recently where you're like, wow, or maybe you helped somebody with a situation they were having, and then all of a sudden they're like, wow, you helped me with this, but I'm also better over here. Like, you know what I mean? Like, just I call those little miracles for people.
Absolutely. And I feel like that happens more often than not, right? When you have a supported and regulated nervous system, that nervous system's going to help coordinate your digestion, your regulation, your movement, just that overall nervous system function.
Right.
So, whenever, yes, we might be talking about what's painful, but like, yeah, that feels better. But what about everything else? Like, oh, did you sleep better after that adjustment?
Right.
Especially with kiddos, like what I typically will tell parents, especially if it's the first time for them to, like, bring their kid in, is, "Okay, well, here's, something that typically is seen, right, after kiddos get adjusted." They might be a little bit more hungry, or they might want another snack. They are gonna most likely sleep better, or they might need another nap, or they're gonna have a bowel movement because 'cause we're supporting that, right? We're supporting that parasympathetic system, that rest and digest.
Wow. That's awesome. Are there things that you see just in your type of industry with what you're doing? I mean, it seems like you've got a really cool niche with mothers, and and of course you said they spread like wildfire because you're
Mhm.
good at what
That's
you
right.
do. What do you see? Like, do you see that mobile chiropractic is something that's going to become more available? And I don't want to say available, but becoming more popular because the women are comfortable at the home, if that makes sense.
Yeah, for sure. I don't know that it will, just because it is a lot, right? You're moving, you're driving, you're, putting up a table, tearing a table down. And especially like as people get older with chiropractic, they don't want to do all of that. They want the table to be there. They want all these other modalities. And especially if you want other modalities, that makes it, way
Right.
harder to be able to transport everything. I don't think that it is going to like be above like brick and mortar. I think there's always going to be brick and mortar with a couple, mobile kairos
Oh yeah,
sprinkled in
mobile.
there,
Yeah,
right?
from the brick and mortar.
Yes,
Right. Right. That's kind of cool. You're kind of like an Uber.
for sure. Yeah.
Think about it. That's actually kind of Uber chiropractic. It's actually kind of cool. I mean, just think about it. You have this brick and mortar, and then you could also have mobile doctors, which is cool. So you're basically
Absolutely.
hitting two birds with one stone. You're covering your territory, uh, and you're just able to meet people where they're at because some people just can't leave their house, even if they're older. So
Mhm,
this is good for older people. This is
mhm.
good for business people. They just need you to come in their office. Hey, could you take care of me, please? Whatever. I mean,
Yeah,
this is,
absolutely.
I think that for the busy worker, it's just,
Yes.
it's perfect. I mean, even for stay-at-home businesses,
Mhm.
this is something, everyone out there, and Dr. Lacey, in how much area do you cover? Like, what is your range in your area?
I have quite a big range, honestly, like, I will drive, you know, 40 miles, but I'm
Oh,
also gonna
wow.
have a travel fee, right?
Right. Of course. I mean,
So, I'm willing to drive. That's not that's not a problem for me, it's whether they want that luxury of me coming to them.
right. Because that is a luxury, man. I tell you, I wish you were right around the corner. I'd be like, "Hey, I need an adjustment right now."
I know.
I'm like this. I'm like, right now, please." But yeah, I love it. By the way, I just wanted to say thank you so much for coming on the show. I love the fact that you're helping mothers and you're not just adjusting, you're adjusting their babies. You're going back to what works. It's old school, but it's also the new school. It's getting to know the person at where they're at, and you're not just trying to get somebody in the door and out the door. It's
Absolutely.
beautiful. I love what you do, and everyone out there, Dr. Lacey, tell people where you're at, where you're, the area that you cover. Just give us
Yeah.
a synopsis on that.
So my base is in Jeff City, Missouri. I cover, like I said, about 40 miles outside of that. So I go Lake the Ozarks, Versailles, Columbia, and all the small like surrounding towns around here.
Awesome. So, guys, get your phone started and give Dr. Lacey Mays a phone call. Like she said, she'll go to at least 40 miles, which is great. And you know, you're worth it, everyone out there. Ladies, you're worth it. You are worth it. And don't keep it all inside. You got to get it out. And when you get it out, you release. And sometimes when you don't release, it will start to cause inflammation in the body without you even realizing it. And then you get stiff. And then you need to call Dr. Lacey Mays. Thank you, everyone. Make sure you go to her Facebook page, Brood Balance Wellness, right on Facebook. Website of course under construction. And I look forward to seeing everybody and making sure that you guys call Dr. Lacey. Have a great day. And again, thank you for so much for being here on the show.
Yes. Thank you for having me.
No, definitely. This was super fun. I got that, and I'm